It is day 2 of Ehlers-Danlos Syndrome Awareness Month, and today's topic is diagnosis story so far. So, I'm not going to go into a crazy amount of detail because I could end up detailing my entire life and every doctor I've ever seen for all of the seemingly unrelated health problems that I have had. But the short version is that I was just diagnosed a week and a half ago, and it really explained a lot of things and was extremely validating because I have had chronic health conditions for my entire life. I grew up with chronic migraines and unexplained pain and frequent injuries and illnesses and symptoms like getting tunnel vision and partially blacking out, pulling muscles and spraining ankles and hurting myself and having bruises and wounds that just seemed over the top to people, or like it couldn't be possible that this was really happening all the time. And just being in a lot of pain, being in muscular pain and joint pain at a really young age, being a very active person but having a lot of injuries, and also having strange allergies that developed over time, like I mentioned, chronic migraines, some autonomic nervous system type things, a lot of brain fog that was interpreted as either psychological or more similar to ADHD or zoning out or dissociation, panic attack type symptoms, cardiac type symptoms, just all kinds of different things. And of course, the joint issues that are the most commonly associated, especially with hypermobile EDS. So having my shoulder pop out and back in, and having a lot of finger pain and double jointedness and cracking joints and things like that. And so over time, I went to lots of doctors. I will give credit to my parents that they always, whether or not they believed me on the inside, gave me the appearance of believing me and wanting to figure out what was going on. And we really tried to go to different doctors and figure it out. But they just never, the doctors just never, I don't know, I don't want to say they never gave me the time of day, but I was written off a lot. I had doctors say, you're depressed, or you need to do yoga, or, that kind of thing, or say, oh, you have carpal tunnel, like, oh, your wrist hurts, it must be carpal tunnel, not looking at how this occurred and how it's part of a larger pattern. And I had really, really severe dysautonomia symptoms at a number of points in my life that I got told were psychiatric in nature. So in any case, all of this, I've been to lots of specialists over time. I ended up asking for a referral to physical therapy a while ago because I just had a lot of pain and no one was really helping. And I started seeing this physical therapist, Andrew Gaetano, at Capital Area Physical Therapy in Malta, New York. He's fantastic. And I saw him during a number of periods of time for various parts of my body, and we were always kind of trying to put the picture together. But I hadn't had a lot of luck when I had previously been referred to a rheumatologist. But when I got together with my partner, who I met in 2016, he has an autoimmune disease. And so I started having a lot of symptoms of an autoimmune disease about a year and a half ago, 2 years ago. And he really, really pushed for me to get a referral to a rheumatologist. And all credit to my primary care doctor, Katie. She said, you have psoriasis, you have all of this pain, you need to see a rheumatologist, it's probably psoriatic arthritis. And so I went through the waiting period, saw the rheumatologist, I was diagnosed with psoriatic arthritis, got treatment for that. Didn't really explain the whole picture though. It explained a lot. The treatment helped to a certain extent, but not fully. And there was just a lot that still wasn't fully explained by it. And in the course of this, she did refer me back to see Andrew again for physical therapy. And so last fall of 2020, he noted that I had parts of my spine that didn't move at all, and then other parts that were very hypermobile, and that my shoulders were hypermobile. And so that would make up for lack of mobility in other parts of my body. And he said, "Oh, you're hypermobile. Tell your rheumatologist about this." So I told my rheumatologist, and she was under the impression that this could explain some of my other remaining symptoms, other types of pain, why I had scoliosis, why I had muscle spasms and cervical spine abnormalities, why I had this nerve pain and a number of other things. And so she referred me to another doctor, Dr. Kelly, to get hypermobility assessment. But that was like 6 months out, and it was so far away that I almost kind of forgot about it. I was aware of EDS because I also have an autism diagnosis, and a lot of people on the internet who have autism also happen to have EDS, and a few other disability YouTubers have EDS. So I was aware that it existed, and I kind of knew what it was, but I didn't think that I had it. I figured I'd probably go into this assessment and they would say, "You're not actually hypermobile," or "We can't help you," or, I don't know. That's just been my experience with so many doctors. So I was in the process of a lot of life changes. This was sneaking up on me. I totally forgot that it was even happening, and I was going through a lot of stuff with a skin condition that I have that's in the process of being diagnosed and is very rare. And so that was the main medical issue on my mind. I had been taken off of my biologic treatment for psoriatic arthritis because of this skin condition. I was in a flare and a lot of pain, and the hypermobility stuff was just not really on my mind. And so this appointment with Dr. Kelly, the hypermobility specialist, snuck up on me. And I had heard from other people in the past that he was like kind of a jerk and full of himself, and I might not have a good experience. So I was real worried about it when I remembered that it was happening. But I went to the appointment, and it was honestly, he was so great, and it was so validating. And really, from like the first 5 minutes, I could tell he was just like watching my body and my mannerisms and how I was responding to inputs and how I was moving in this way that people usually don't, with this attention to detail and like desire to contextualize it, that I don't see with doctors frequently. And one of the things he said to me was, even if you don't meet the criteria to be diagnosed with one of these conditions, I will still help you live the life you want to live and be able to do the things you want to do and cope with the symptoms you're experiencing. And that meant so much to me. Like, whenever I tell people about that, I get tingles and I feel like I'm going to cry, because that's such a big deal, and so many people don't check all of the boxes to get a specific diagnosis, but it doesn't mean that what we're experiencing isn't real and isn't affecting our lives. But I imagine I'll talk more about this assessment in a different video, and I don't want this to go on for half an hour. He did a really long assessment that was very hands-on and very interesting, and I look forward to sharing that in the future. But he basically said, you like very clearly have an Ehlers-Danlos syndrome, but I don't know if it's the hypermobile type or the classical type, because I have a lot of dermatological cutaneous skin things, which led him to believe it might be the classical type. So he didn't want to necessarily rule that out and say it's hypermobile without further investigation, without me seeing my dermatologist again. Because actually when I was at my dermatologist, the last time that I had biopsies for my rare condition they're trying to diagnose, he had been fascinated by the fact that I was seeing a hypermobility specialist and was like, do you have an Ehlers-Danlos syndrome? And I was like, I don't know, I gotta go see this hypermobility guy. I don't know what he's trying to find out. So anyway, Dr. Kelly, the hypermobility guy, said I do have an Ehlers-Danlos syndrome. It's either the classical type or the hypermobile type. He's leaning towards classical. However, the genetic test that could tell me for sure I had classical is not covered by my insurance, because apparently the clinical treatment of classical and hypermobile are very similar. So the insurance doesn't think it's important to differentiate between the two. In any case, he also said that he believes I have POTS, or postural orthostatic tachycardia syndrome, which is something that my rheumatologist also believes that I have, and had previously referred me to cardiology to have the official tilt table test, but their office flooded when I was supposed to have it. So I ended up doing more of an at-home type of heart rate monitoring thing because I couldn't go to the actual cardiologist. In any case, I look forward to sharing more about POTS specifically and dysautonomia more generally in future videos, because that affects my life a lot and it explains so many things. A number of other people in my family also experience it and never knew that's what it was. So yeah, he diagnosed me. He also thinks I might have mast cell activation syndrome, which has to do with having allergic-like reactions to various things. And he gave me some resources to look into, some lifestyle things to do, especially for the POTS. I have to wear compression sleeves on my legs and compression socks, and he gave me information about braces, and as far as like staying hydrated and lifestyle things that I'll go more into in the future. I feel like I'm kind of getting off track. I have another appointment coming up there in a month that has to do more with like an exercise assessment and stuff like that. I also went back to my primary doctor after this because she's kind of taking point on all the different doctors that I have to manage, and got referrals to all the specialists I need to see, because EDS is a connective tissue disorder, and there's connective tissue in all your body parts and all your body systems, so I need to get most of them checked out to make sure I don't have anything weird going on, especially cardiology and neurology and ENT, because I have a swallowing issue and I have hearing issues, GI because I have some serious GI problems. It's a lot of different specialists. So yeah, that's how I got diagnosed. I don't know if I'm going to be able to get the genetic testing, but I do think that the next time I'm able to see my dermatologist's boss, who is the head dermatologist, he may be able to make a clinical determination on if he thinks I have classical EDS or not, since he is the skin specialist. And I don't know which day of this whole thing is when we actually talk about symptoms. So if you don't know what any of this stuff is, you're probably like, thanks for the whole story, but what's actually wrong with you? I'll tell you on whatever day that's supposed to be. I think it's tomorrow. I think tomorrow's symptoms. Today was diagnosis story so far. I will say that I have found my family members who also have this condition, and the associated conditions. And the interesting thing is that they're on both sides of my family. So I don't know how that impacts me genetically, if that has anything to do with the fact that I seem to have more severe systemic issues beyond the joint hypermobility parts of it. But that's the story of that. Yeah, it's really weird because it's a really big deal, but it also, and it means a lot for my future life, but it also explains so much that has never really been understood or validated. And I felt very alone and alienated, and now that I have a name for it, and I have doctors who know what it is, and a community of people who also deal with this, that's really fantastic, even though the implications of what it means for my life are a little bit scary. So major thank you to Andrew, my physical therapist, and Jonathan, my partner, for forcing me to see a rheumatologist who had the foresight to refer me to the hypermobility specialist and to Dr. Kelly for listening to me and like seeing me and taking his time to do the assessment and to work with me in the future. So if you got this far, thank you for watching, and I promise I'll actually explain what the heck is wrong with my body tomorrow. Bye.